Oh, thank you for inviting me. I have to say, I've been running a support group for the past 7, 8 years, 2 support groups. I've never been more impressed by the number of people in this room. I've never seen so many people in a first meeting like this, and I think I'd like to say that's how a support group works. And because I've been asked to come and talk to you about how a patient support group works. I'll just give you a bit of background about myself. I'm a clinical nurse specialist at the Royal Free. I look after leukemia patients, and I've also looked after myeloma patients. I've been working with the Myeloma UK and Myeloma Support Group for the past 8 years. The group has been running for 10 years, for more than 10 years. And in terms of a support group, I think that's very, very impressive. And over the last couple of years, I've also started working with people with leukemia to start a new support group. And what I can say about a patient support group is it belongs to you. It doesn't belong to the nurses. It doesn't belong to anybody else. It belongs to you. And how it works and how you want it to work is pretty much determined by what you want. My experience of running the support group is we meet every couple of months because we find out earlier on that meeting a lot more often means that people may not have the time, may have other things to do, and you may not always get big numbers of people coming together. So how often people meet is pretty much determined by how often you want to meet and what works for you. The way we've been running the support groups has been divided into sections. We meet up and we have a formal talk. Basically, the patients choose a topic that they want to discuss, whether it's travel insurance, whether it's about the kind of treatments that are available, whether it's about clinical trials, whether it's just about the general things, and whether, sometimes just discussing what's relevant to the patients. And the way we do it sometimes, because carers are very, very important part of a support group. So other times we divide the patients because there are issues that are relevant to patients that they may not really want to discuss in front of their carers, and there may be issues that the carers want to discuss but don't necessarily want to discuss along with the patients. So at least a couple of times a year, we divide the group into two, and we discuss whatever the patients want to talk about. And one of the things that I've learned from my experience is patients are the best people to talk about what they need, about their condition, to share their experiences. As nurses, we are experienced in telling you what the symptoms are, what your disease is, and how we can manage your disease. But as patients who come together in a support group, you learn a lot from each other. You learn how one patient's experience might be very relevant to another patient, or you learn about something that you probably thought was just unique to yourself, something that maybe you were worried about talking to the doctors or just discussing. And then when you come up in a group of people who want to discuss the same things, it is very, very helpful because then you are comfortable with each other, you are comfortable with your experiences. Because I can't say to someone, this is how you're going to feel, because at the end of the day, I'm not the one who's going to be receiving the treatment, but somebody who's been receiving treatment will be able to talk to somebody else and say, I felt really bad, I really didn't feel like taking medication, for example, or I had these symptoms and it felt really awful. Or somebody could say, I really wanted to go on holiday. I hadn't been on holiday with my family for a very long time because I was scared. And then another patient would say, actually, I went on holiday and I spent 2 weeks away somewhere in England, somewhere beautiful. And it doesn't necessarily always has to be away from England. Those kind of experiences, they are very, very important, but it's the experiences that only patients within a support group can share. And one of the things that I also learned is when you go in a support group, you shouldn't be obliged to discuss your experience. You may just want to listen to what other people have to say until you feel comfortable about discussing how you feel. Or you may not even want to discuss anything at all, and that's absolutely fine. Not everybody wants to share their experiences. Some people just want to listen. That's how they get the support from just being within a group. And then there are other people who like to talk about themselves or about whatever experiences they've had, and that's absolutely fine too. So as time goes by and as you meet more often, you begin to feel more comfortable. It almost feels like it's a family where you can be comfortable and discuss things that maybe you feel you can't discuss anywhere else. And I found that support groups can be a very safe environment. But whatever happens in your support group is pretty much determined by how you want it to work. And as nurses or health workers, we can facilitate for the things to happen. We can arrange for the venue. We can arrange for speakers. We can make recommendations to say, let's say, for example, you want to discuss about travel insurance. I'll just pick something that's pretty much obvious. We can find out information and say, we can come to you, for example, and say, you've got experience in travel insurance. Who do you think is the best person to come and discuss travel insurance? Or things like complementary therapies. We've had sessions where we brought somebody in just to discuss about complementary therapies, just to help people relax, just to help people find other ways of coping with their disease. And we've had invited speakers to discuss exercise, for example. Do people really want to exercise? Is it really important? Yes, it is for some people. No, it's not for some others. But we've had, experts who've come in and said, you know what, it's okay. If you want to go for a short walk, it's a good exercise. If you want to go for a long walk, it's a good exercise. When you're feeling good about yourself, you can do certain things. But whatever it is that you want, that you need to discuss, that's what a support group should be like, and it's supporting each other. And one of the things that we do in our support group is we get names and contact numbers of the people who within the group wanted to be contacted. So for example, you may want to keep in touch with a certain person, but maybe not necessarily the whole group. So you can choose to speak to someone or you can choose to share your experiences in an email with everybody else. But, and what we find is just, we've got a volunteer. We try and get volunteers from the patient group to say, because this is your support group, to say who would like to be the person who's going to get everybody's details and share them with everybody else. And some people go on the list, and then maybe after a couple of emails, they decide that's just not the right thing for them, and then they just come off the list. They don't want to keep in touch with other people, but just come to a support group to discuss as and when they feel like when they need the support really. And one of the things that I also learned from experience is people should really not, in a group, you really should not be scared about sharing your experience. I think it's really, really important because it is what makes the group. And you don't necessarily have to attend every single support group meeting that's there. You can choose to attend whichever ones you want. And the great thing about having different topics to discuss is you can choose to say, yes, there's going to be somebody who's going to be talking about something really technical, about a new clinical trial, about a new treatment. And I don't really feel like listening to that kind of thing, but I'd really like to go and discuss, complementary therapies, for example. So you could choose whichever, group you want to attend, but not feel pressure to attend each and every single support group. And with time, you'll find that, you may want to attend. There are some people who really enjoy attending every single one of them, and there are some people who just want to go for specific topics. And one of the most wonderful things that we do as a support group is Christmas time, or a couple of times a year, we have a social where we just bring, little bits of food, cake, pastry, and just not discuss the heavy topics. Because patients live with a heavy load of the disease every day. You don't want to be discussing your disease every time you meet with, with other people, but you could just, go have cake, have a chat, and see, just relax and enjoy yourselves, and, just have a bit of fun. So I have to say again that I am really, really impressed that this, for a first meeting, is absolutely amazing. And if things continue to go this way, I think I might just join you for every single I might just come and join you for every single support group that you have, every single support group meeting that you have. I don't know, just ask me any questions. I didn't prepare any slides deliberately because I think I just like talking. So, and I think keep it a bit informal as well.
How do you fund your support groups?
So our support group is not funded by anyone. What we've done, we've been really lucky enough to get somebody who's offered us a venue. So at every meeting, people donate, whether it's like £1 or 50p, and we use that money to buy tea, coffee, refreshments, cake, and
I was reading more or less what venues you use.
So we use one venue, and that's a place that somebody from UCH has donated. They've discussed it with their department, and their department has offered us the use of that place. And I have to say also one thing about a venue is just finding somewhere that's really central, easy to get to. Because if you're going to have a meeting, you want people to be there, and you want people not to feel like, oh my goodness, I have to get 2 tubes and 3 buses to get to to the venue. So, hopefully, you'll be able to find a place where you can be offered a venue.
This time, in this particular patient support group, the Rural Free Charity has actually donated like a large amount of money in order to help the setting up process. And there is still some of the money that will be used to continue for venues, for transport fees, for buffet, for refreshments, things like that. So, later on we will have like an informal discussion of people who wants to get involved, and then we can slowly transfer those responsibilities over the next few meetings, and you could use that money and the resources that we have for the benefit. Because one more thing, like in the Rural Free, there is some space at the Rural Free that booked quite a long time in advance. It's free for patients. So this time round, we wanted to do it in a big.
Why I ask that? There is an inaugural meeting in Bristol.
There's an inaugural
meeting in Bristol for the Southwest this coming Thursday.
Yeah.
If anybody is interested, but the venue is probably just a handy venue as far as transport is concerned, but it's not a very sort of good venue as far as an actual discussion group.
Yeah.
But it's the foot is in the door, and we hope to continue from that point.
Definitely, they will be growing slowly, isn't it? I suppose that you're talking about the NATO groups, yeah?
Yes.
Yeah, exactly. So they are all over the country, and I know that a lot of you have made a big effort coming all the way here to Rural Free. And I'm sure that I understand that some of you will not be able to come all the way here for every meeting that it happens. But if you live local, or if it's okay to do it every other meeting or something like that, that would be great to see you every time you come. And definitely you could use also the other NATO groups that they are closer to your area, if you find them useful, just because it's more convenient.
Yeah.
Can I just make another point that there was only 5 members at the inaugural meeting to sort of get it started, but one was a new patient that had fairly reasonable or serious surgery, and there was some which were probably well experienced with having had operations in the past, and some which have been sort of a member of the group for 10 years. So we had a very mixed, and the ideas that went around the table were very, very satisfying from all members in different ways. You got something out of it.
Yeah, that's the other thing. That's one of the reasons why I've said I'm really impressed by the number of people who've come here. I've been to start up support groups where 3 or 4 people have turned up. And if 3 or 4 people turn up and they have a productive meeting, it's equally as important as having a lot of people turn up, because just because it's a small group, sometimes, you had a really good discussion, and I presume, and it was very productive. So a bigger group doesn't always necessarily mean that you're going to get something out of the meeting. You will get something, but sometimes a more intimate small group will just grow. And I've been with the support group, the myeloma support group, for, like I've said, for more than 8 years. And it started off as a very, very small group. And I mean, I still get amazed that a lot of people turn up. We normally get about 30 or so people at every meeting, and I think that's pretty much amazing. So I find this is really, really amazing. Is there any other questions that you'd like to ask? You could ask me anything about.
Yeah, let's have one more question and then.
You mentioned in your talk that one of the possibilities for a patient support group is that lists of people can be made available,
yeah,
and that they can then contact each other, and there can be a kind of a cross. Is that something that this group is? I think that's a fantastically good idea, and I think for patients to be able to talk to other patients is, potentially very valuable, and for families. It's just the mechanics of how that would happen in this group, with patient confidentiality. Are we going to have to sign that we are happy for our name to go on such a list, or how do you envisage the mechanics of that?
So I think it needs, usually it should have just one volunteer, one person who will be in charge of, will have the whole list. And then my advice, because I think there's probably things like email hacking and things like that, I probably would not discuss things that are very confidential. Probably just keeping it. If you want to discuss something, so with time you will find people that you can kind of talk to, and maybe exchange telephone numbers. But one of the benefits that we've found with having a list is then, if there's anything new that's come up, you can email the group and say there's going to be a meeting, or email the group and say, what sort of topics would you like to discuss at the next meeting or in future? Or there's something that's going on, you're doing a fundraising, selling tea and cake to raise funds, or anything, any events that are going on, or if you've got something that's you need to share.
You actually need a webmaster.
Yes, you need one person.
Group,
yeah.
So that you can maintain
the
contact between
the people.
Individuals.
And I would say as well, there are various other ways of doing it. I mean, whoever ends up running that side of this group, you can do a closed Facebook group, for example, where you can only get in if you've got a password to it, and that's a private place where I know a lot of patient groups do that online, because it's a very secure way of where you actually can discuss more personal things. It's not not on. And of course, we do have the London Forum on the Net Patient Foundation as well, which you're welcome to use as a discussion area.
But my advice would be, if you're not comfortable putting your name on the list, don't put your name on the list, and you can then just rely on maybe getting in touch with one of the coordinators. But it's a brilliant way of keeping in touch and just raising topics that people want to discuss.
Most of you have contacted me through email by confirming your attendance, so you can also recontact me again if you would like me to share your email for the purposes of the group. Also, with the Rural Free Charity, we are actually setting a group email from which, when there is a volunteer that would be happy to administer this process, would be in touch with the people that is happy to share the emails with this patient support group. So I can see some interest. I can see that there are some dynamics that you would like to explore, and that's actually the purpose of this group. So there will be something that we can create it over time between all of us.
And I can guarantee you that you are going to be the experts on the support group. We'll be asking you questions about support group and everything else.